At Centre for Mental Health, we've been working with NHS colleagues to create a model that attempts to forecast the demand for mental health services that will arise from Covid-19. It's been a very difficult time for many, but trying to quantify what that actually means in terms of service demand is something we've been working hard on over the last few months. And this really is just to go through the summary of the results that we've got from this work, which takes really robust evidence that we have on different groups and their experience of the pandemic, and then brings that together in a model which then calculates numbers of people. That model is available on our website under the toolkit page, and it's freely available to all. The model has been designed by a multidisciplinary team really to help local areas to assess the demand that they're likely to face over the coming years. However, we've also used it as a national model to give some indication really to policymakers and others about what exactly we're going to be seeing over the coming months and years. So I'll just take you through the general results now. So starting with adults in England, we estimate that those who've not experienced mental ill health prior to the pandemic will see 1.33 million people have moderate to severe anxiety, and 1.82 have moderate to severe depression. So these people who haven't experienced a mental health problem before but are now, and that's based really on the impact of enforced lockdown on people. For those who have existing mental health conditions, it's 2.5 million people for anxiety and 2.6 million people for depression in terms of service demand. Now, there will be some comorbidity there. What we've been asked to do for the model is to list out each need individually so that service providers can see the kinds of services that they'll need. There's also not a clear way actually to work out how you discount for comorbidity at this time, so we've put them both in. NHS workers, obviously we all know they've been on the front line of treatment, and it's been harrowing and very difficult. The research suggests that 200,000 NHS staff may need treatment for post-traumatic stress, psychological distress, and 81,000 for burnout. We know too that there are other groups, such as those who work in care homes and in social care, but the research isn't robust enough at the moment to be able to get figures for those, so that'll be included in future forecasts. For those who've been in intensive care units with Covid-19 and then have come out and survived, there were 6,150 people in this bracket, and we estimate that 630 will need help for anxiety, 450 for depression, and 350 for post-traumatic stress. Their families obviously also suffered a burden from this as well, and there's 791 requiring clinical help for PTSD, 441 for anxiety, and 136 approximately for depression. Now, bereavement has obviously been difficult in two ways. Firstly, losing people is hard enough, but secondly, because of the COVID restrictions, it's meant that people have had to say goodbye to loved ones as they go off to the hospital, and that those people have died either alone or with medical staff, and that's incredibly tough. And then funerals have been obviously much smaller. So we think there'll be a need for 36,000 people to have mental health services as a result, and that's a range of depression, PTSD, and so on from that experience. And then finally, I'm the Chief Economist at Centre for Mental Health, so unemployment is a big impact for me in terms of how that works on people's mental health and how it makes them feel in the long term. At the moment, there is something like 1.448 additional people claiming out-of-work benefits over the last few months, and we think that will translate into 30,000 people who have a need for major depression services. Now, there are two things to say. One is the prevalence rate for that group is quite low according to the research, so the translation from unemployment into treatment. But secondly, I think a lot of this unemployment data is yet to show its hand, and actually things are going to get worse, and therefore the numbers of people will increase. The result is that it's 20% of the adult population, so 19.99% to be precise, and that is a very large increase in service provision, and something that actually we need to prepare for now. And that really is the purpose of this model, is prepare for this now, because these are needs that are coming down the line and that people will need services for. And the model works in predicting the need and then discounts that further for those that will actually use services. So we're only looking at a small proportion of those using services as a result of the need identified. So they're big numbers, but the point to retain is that actually if we have the information and we have an idea of the numbers, then we're able to prepare and we can deliver something that will help those people in the future.